All right. Hey, Kimmy. So we just got done with our Instagram catastrophe and we decided to meet on Zoom. And I'm wondering now, I almost think like we should just do all the things on Zoom. So the idea of doing an Instagram live or a Facebook live is exciting, but technical difficulties will kill it. So anyway, let me reintroduce. I feel like I've done this introduction like 5 times, but um, it's Mouth Breathing Awareness Month, and that is a campaign that I've set up because I want to bring awareness to the fact that mouth breathing is a really bad thing. And I think with this whole coronavirus situation, people get that a little bit more. I hope people are connecting the dots between mouth breathing and like nasal breathing, and your nose is doing a job to clean and filter air. So you shouldn't be breathing through your mouth, right? Um, but what I'm trying to do with this awareness campaign is highlight and really just kind of show off all these amazing people that I get to meet who are healthcare providers. So you're a hygienist and a myofunctional therapist, and you also have myofunctional issues, and you've worked through a lot, just like I have. And I know that you discovered at one point that you were mouth breathing. So I would love to have you share your story on how you've connected the dots between mouth breathing as a kid, even, or even if you only do it at night, it's still not good. So I want you to share your story on your journey and the things that you've been discovering and working on for your own health. And yeah, and you can talk about your practice too, because I know you're in Denver. Your myofunctional therapy practice is mouth muscle memory. So I want people to look you up and find you too.
Yeah, thanks, Sarah.
Yeah, you're welcome.
So yeah, I'm in Denver. I do online and in person. And then Megan Van Noy and I have a fun, sassy Myo podcast called The Munch Bunch. And that's been our quarantine baby. So it's been really fun. You should go check out our episodes. And yeah, I definitely had myofunctional disorders. I did not figure that out until I took just a continuing education course about it. And I was like, oh, that's why I'm so messed up. I never knew.
You're not messed up.
Not anymore. So when I was a baby, I was able to breastfeed, even though I had a posterior tongue tie. So no issues with that. But when I was about 4 years old, I got allergies and I couldn't breathe through my nose anymore. So sick a lot and mouth breathing like crazy. Most people would be horrified to admit this, but I don't care. In school, I would drool on my desk during class.
Oh my gosh.
Like 10 years old, just drooling on her desk because my mouth was open all the time. I never knew that was bad. I'm like, it's just breathing, right?
Isn't it crazy? Yeah.
Yeah.
And it's so common. And I think it's good that you're like so out there with like, nobody would want to admit this, but I'm going to just say it because honestly, so many patients can relate. They really can. So.
When I was in high school, the movie Napoleon Dynamite came out, and there's that scene of him just standing there by the bus, like, and honest to God, I totally would breathe like that all the time. And when I was in high school, I caught my reflection of me doing that and I was like, oh my gosh, that's embarrassing. But I couldn't breathe with my nose, so I'm just like, I'm just going to keep it about that far apart. And so then I don't look like Napoleon Dynamite, because that was kind of a wake-up call, like, oh, yeah, we're samesies.
Totally. And there's such a social stigma around like that look, like that mouth breathing look. And Napoleon Dynamite like captures that perfectly. And it sucks when you realize that's you, right?
Yeah. And then I'm drooling and all these things. Megan and I said on our podcast, we're like, even pretty girls can have myofunctional disorders.
That's really funny.
Yeah. So then when I was in my 20s, they invented like the steroid nose sprays. So I could breathe with my mouth some. But by the time I had gotten to college, I was 18, I flattened out all of my teeth with teeth grinding.
Wow.
I'll kind of zoom in so you can see.
Oh, yeah. Okay. Do you want to explain the connection between mouth breathing
Mm-hmm.
and grinding? Like some people might not know
Yeah.
that.
Yeah. So I have had nose congestion and nose problems forever. And so in my sleep, I would breathe with my mouth, and I would actually be choking on my tongue from my tongue tie as well. And the combination of those two, I would stop breathing and I would wake myself up grinding my teeth really hard. I've even chipped them in my sleep. So the lack of oxygen to my brain would send a signal to my jaw to move it. Also, when I was going through braces, I had palate expansion, which didn't expand me far enough. And so I have bone growth on the roof of my mouth and under my tongue. Um,
Are you talking about tori?
Tori, mm-hmm.
Okay.
Yep, the
Interesting.
tori
Yeah. You're
and
making
the
some good
flat
connections. So
teeth.
what you're talking about with your teeth grinding, people don't realize that's signs of sleep disordered breathing and
Mm-hmm.
potentially sleep apnea. So did you get diagnosed with that or did you just notice that was happening?
I never got the test done before I had my tongue tie surgery, but once I learned about myofunctional disorders, it kind of put all the pieces together for me, because they had to remove teeth when I had braces. I had a small, narrow mouth. I was grinding my teeth, and I had dark circles under my eyes, which I put makeup on, so I didn't want to broadcast those. But dark circles, peeps, not good.
And can you explain that connection? Like, is it just lack of
Yeah.
sleep or what else do you attribute it to? Allergies?
The dark circles under your eyes means that you're not breathing well in your sleep. We call it venous pooling.
Hmm.
So a lack of good oxygen is what causes that. And I actually asked so many people at makeup counters, like, why do I have these dark circles? And they would always just say, like, oh, you've got thin skin, so use this eye cream,
Of course.
use this concealer. But once I kind of got to the root of my sleep problems, I kind of have been able to work on that.
Yeah.
Also, with the teeth removal, I have a smaller jaw. And so I'm like, how come I weigh 140 pounds and I have a double chin? This makes no sense to me. So then when I did
Mm.
myofunctional therapy, I realized that that was my tongue posture. Even though I had learned to keep my lips together, my tongue was still resting low. So I had this double chin.
You're
So,
bringing up such good points because a lot of times, I mean, I'm so focused on the health, a lot of times I don't really focus on the cosmetic stuff, but that's what patients, that's what people are looking at. We all care how we look. And so I think it's good for us healthcare providers to realize like so much of what might drive our patients to go work with us and find us might be actually cosmetic stuff like you're talking about. So I'm glad you're sharing that.
yeah. And then just, I mean, health stuff too. I would wake up choking in my sleep. I'd wake up gasping for air. I have a king size bed and I would roll around my bed, that restless sleeping. And that was like another sign of my sleep disordered breathing. I had chronic nightmares every night of my life and since I was a small child. And so all those things are getting better with the myofunctional therapy and then realizing I had the tongue tie. So
Good. So you really quick, I want to make connections because there's so many people, including really amazing, smart doctors and dentists and hygienists and speech pathologists who don't realize that these things are all overlapping and connected. And it all comes back to our breathing and our sleep and our soft tissues like our tongue and our lips and all that stuff. So talk a little bit more about the connection with the nightmares.
yeah, the nightmares is an interesting one because I asked a lot of doctors and therapists, like, why do I have nightmares every night? And they would just say, like, oh, you're anxious. It had nothing to do with that fight or flight thing. But when you can't breathe at night or you're choking in your sleep, your body's trying to wake you up
Yeah.
and do something that scares you so you, wake up from that
When you
nightmare.
you are in fight or flight, like if you're mouth
Mm-hmm.
breathing, your body's automatically shifted to a more sympathetic tendency. And so I can only imagine, I mean, yeah, that's got to be rough. So you probably were anxious and stuff even during the day. I mean, do you feel like you had anxiety?
Oh, for sure. Yeah, definitely generalized chronic anxiety disorder, anxiety attacks, and then the nightmares. I would be afraid as a kid to go to
Oh,
sleep,
yeah.
and I would always be waking up like I had a bad dream.
Aw. So you've started to work on yourself. So talk about how all this stuff has gotten better, because I know it has for you.
Mm-hmm. So first off was just like, okay, how do I breathe with my nose? Like, what are the tricks I can find? That's like one thing I'm really big into.
Mhm.
And then starting to like learn about myofunctional therapy and then treating myself at the same time.
Mhm.
That's all been really helpful. I still, it's like mouth breathing is like a lifelong struggle. Like I have to focus on it all the time. I still do it every day. It's just become a habit. So I'm trying to break that.
But your nose is
And
now clear, like you can breathe through it, right?
I can breathe through it. Yes.
Yeah.
Yes.
But
And then
it is a habit. Yeah.
at nighttime though, it's crooked in here. So I wear little things to prop my nostrils open. I'm a big proponent of mute nasal dilator, and
Cool.
then lip taping to keep it together. That's helped a lot because I had weak muscles, so everything would just fall back. Like Napoleon would return at nighttime.
You're awesome. I love how you're sharing all this stuff. I think people will really relate. That's the whole point of this. So I appreciate you sharing it and being so willing to just like all the details, right?
I know. Yep, everybody does it. Nothing to be shy about. We're all just goofy, but I think realizing that a lot of the health issues I had were because of my breathing and my tongue posture, all those things, because I could sleep 12 hours a day and still feel exhausted
Yeah.
because of the mouth breathing. And so now I can sleep like in 7-8 hours and feel good.
Yeah.
I remember as a kid, I would feel like, do I have dementia? I can't remember things. Like my brain
Even as a
feels
kid.
foggy. Yeah. I would like
Wow.
read about things. I'm like, oh my gosh, I wonder if I have dementia. I don't have a good memory. Like my brain feels foggy. It's kind of hyperactive kid.
Yeah, which goes hand in hand with all this
Hand in
stuff. I mean,
hand. Yeah.
so did you have a sleep study? Like, did you end up getting tested for sleep apnea?
No, I tried so hard, but I never got it done in time because I was able to get my surgery a little bit faster. And so I never got
Okay.
the sleep test, but I mean, it was significant. Even the night of my tongue surgery, I stopped grinding my teeth from then on, which was
Okay.
helpful. Yeah.
Awesome.
And then the first night I used my nose dilator, I didn't grind my teeth either. So that was like a big thing. Because in dentistry, we're always told like, oh, you're grinding your teeth because you're stressed. You have
And you need a night
anxiety, so
guard.
you're grinding your teeth. You need a night guard. But
Yeah.
it definitely was breathing. So that's one of the big things that I'm a big believer with is the nose breathing and working on
Yeah.
that to help with
So how about
grinding
the
and clenching.
nightmares and what about some of these other symptoms? As you've changed your breathing, has that gotten better?
So much better. Yeah. I still will get nightmares, but honestly, it coincides with my congestion. When
Really?
I'm
Okay.
sick or if I have a cold, I'll have nightmares. Or if my little nose things fall out at night, I'll have a nightmare. But the nights where I am wearing my mutes and I have my lips taped, I can stay still. I'll stay in the same position all night, which is
Wow.
pretty amazing when I would roll
That is.
around a king size bed,
Yeah.
wake up sideways or upside down.
No, that's great. I'm glad you're doing so much better. What do you see as like your future treatment? So you're working on the nose breathing now. You had your tongue tie release. You're obviously going through myofunctional exercises and helping yourself in that way. What do you see in your future as far as other treatments or anything else
Mm-hmm.
goes? Like, do you have anything else on your radar?
Yes, because I have a small, narrow mouth and they took out those permanent teeth, my bicuspids. My long-term goal is to get palate expansion, which
Cool.
is going to help drop my palate down so my nose has more room. And I think that's going to help with a lot of like the long-term nose breathing goals.
For sure.
So I'm really excited about that.
Yeah.
I think I'm probably going to go with a DNA appliance
Okay.
with
Awesome.
probably with Dr. Liz Turner, I think.
Okay. And is she in Denver? She must be.
She is, yeah.
Cool. That's exciting. We give her a little shout out.
Yeah.
Well, I mean, I really appreciate you sharing this, and I wish we could do this on Instagram Live so that people could actually have questions to post. But anything else you want to mention?
No, I think that's it. I think with the whole myo piece, like if you have anatomical issues like with your nose or allergies, you just have to do a little bit of like product trial and error, see what works for you, because things
Yeah,
that work for me don't work for other people. For
that's true.
example, my boyfriend, he hates anything in his nose. He can't handle it. Lip taping makes him want to die. So for him, I have him wear a Breathe Right strip and a chin strap. And ironically, I am dating another mouth breather. So
It's so common.
yeah, I diagnosed him on our first date. So
You're hilarious. That's so awesome. That's funny.
I know that's
Um,
so me.
well, yeah, I think no, this is really good. So thanks for sharing. So, all right. How, if you, do you want people to get in touch with you for therapy and stuff? What's the best way for them to do that?
Please, my email is is mouthmusclememory@outlook.com, and my website is www.mouthmusclememory.com, or you can
Cool.
find us on Insta or
Instagram.
Facebook. Yeah.
Awesome. I'll link all that stuff so people can find you in the video that this will go up on YouTube, and then we can share it other places too. So
Awesome. Thanks,
awesome.
Sarah.
Thank you, Kimmy. This is super fun. I'm so grateful to have you share this stuff. So yeah, thanks for your openness, and I can't wait to see you again sometime when we're not like on shelter in place and lockdown and all that. So all right, I'll talk to you later. Bye.